training, and I'm going to be demonstrating a nasogastric tube insertion. First thing first, I'm going to check my doctor's orders and reason for the NG tube insertion. I'm going to be inserting for suction. So I'm going to enter the patient's room. Hi, I'm Katie. I'll be your nurse today. Can I have your name and date of birth? Okay, very good. And I'm also assessing that the patient is able to respond to this. Hi, Mr. White. We're going to be doing an NG tube insertion today so that we can suction your stomach. All right, very good. Then I'm going to measure from nose to ear, just like our process. And then I'm going to mark it with a Sharpie. To check the patient's nares, and also the back of the throat for any lesions or any problems with their teeth or gums. Okay, very good. Now I'll apply clean gloves. Towel and add the space on the patient's chest. I'm going to lubricate the first 4 inches of the tubing. All right, Ms. Wright, now we're going to insert this under your nose. Make sure his head is back. Now I'm going to insert the tubing. Make sure there's no resistance. Okay, I don't have any resistance. No. I'm going to check the back of the throat for any coiling. No coiling. Okay. Now I'm going to ask Mr. White to put his chin to his chest. And to swallow. You doing okay? And you can still talk. I'm going to have some water here if it's in the system swallowing. Okay. I'm checking again for any cooling in the back of the throat, and I don't see any. I'm going to insert to what would be our marker. This doesn't go all the way in, so. All right, very good. Are you okay? Said yes. I'm going to temporarily anchor the tube to the cheek. All right, very good. Can temporarily anchor the tube to the cheek. He's able to talk. I'm checking for coiling. Back of the throat, there's no coiling. All right. I'm going to aspirate. This time I'm getting gastric content. If the hospice policy would be to check the pH balance, I would have enough that I could check the pH of the gastric content. I'm also assessing for the consistency, the amount, and the color of the content. Okay? Now I'm listening. So I reintroduce the content. And I hear a gurgling. So I'm sure that this is in the right place. Okay, and at this time I'm also going to measure the amount of exposed tubing so I know for baseline next time when I enter the room. And if the hospital's policy would be to get a chest ray to check for placement. Okay, so I'm going to hook this up to suction. And I'm going to anchor to nose. With my Y tape that I had ready. Okay. Then I'm going to anchor to the gown. Are you doing all right? Okay, very good. Make sure that my NG tube suction, low intermittent suction is hooked up. I'm going to ask him if he needs anything, remove all this from his bed. And later I would record the time of insertion, how the patient handled the insertion, the baseline measurement of the amount of tube exposed, the amount of content that was aspirated, the consistency of the content, also the size of the tubing that I used.